the Institute for the Study of Peak States presents the second International Psychoimmunology and Psychobiology Research Symposium. The subcellular psychobiology of type 1 diabetes and implications for treatment, presented by Dr. Mary Pellicer.
Diabetes type 1 affects millions of people around the world, and the incidence seems to be increasing in the US alone. An estimated 40,000 people are diagnosed with type 1 diabetes each year. Many of these are children and adolescents. The Institute for the Study of Peak States has been researching type 1 diabetes on and off since 2011. With our recent breakthroughs in psychoimmunology, the re-energized research team is hot on the trail again. Dr. Mary Pellicer is the Medical Director of Applied Research of ISPS and is currently part of this ongoing research. She is here on behalf of the rest of the team to share a bit of this fascinating journey. Dr. Mary will be playing the theme song from Rocky in her head as she imagines the thunderous applause as you welcome her to virtual lectern to present her talk titled The Subcellular Psychobiology of Type 1 Diabetes and the Implications for Treatment. Thanks, Mary.
Thank you, Shane, for that lovely introduction. Now I have to get Rocky out of my head. Let me share my screen. And we are off and presenting. All right. I am going to share with you what we are doing in research around type 1 diabetes. I did not come up with the name of this talk. That is all Dr. Grant. But I do want to start off with a quote. Well, it's not actually a quote. I have never been able to tell that Einstein actually said this. It's often attributed to him, but I love it anyway. It seems like something he would have said. That you cannot solve a problem from the same level of consciousness that created it. You must learn to see the world anew. For me, that really embodies the power, the amazing power of what we are trying to do in the Institute, of see things absolutely anew and let go of prior assumptions and prior learnings and say, what is really going on there? And that is why I love that quote. Okay, now on to diabetes. Just very briefly, what is type 1 diabetes? It's actually, I'm talking about type 1A diabetes. There is a type 1B, but type 1A is the type of diabetes where there's been autoimmune destruction of the insulin-producing beta cells in the pancreas, which are in the islets of Langerhans. And I thought, the German pathologist Paul Langerhans doesn't get enough credit. So there is his picture with a microscopic view of one of these lovely little islets. As far as the current medical management goes, basically in type 1 diabetes, which is a completely different disease than type 2 diabetes, I just want to make that clear. So in type 1 diabetes, insulin is absolutely required for the person to inject themselves with, because those lovely little islet cells in their pancreas have been destroyed by the body. That's what it means, autoimmune. The body's destroying the cells, and they are no longer producing their own insulin. It is impossible to live for very long without insulin. The person's body goes into something called diabetic ketoacidosis, and if not treated, and if not, insulin is not given exogenously from the outside, the person will die. So having a diagnosis of type 1 diabetes means that lifelong insulin therapy is needed. Now, in the past, and there I have a lovely little picture of one of the early Lilly cases for giving insulin. They're much more compact now. But for a long time, that involved the diabetic giving themselves not only daily, but multiple times a day injections of insulin. Now, there are something called insulin pumps that can automatize this to a certain extent, but in some way, the patient actually has to do the work of the now absent beta cells in the pancreas, or they will die. The other thing that's needed for management in trying to play that role of a pancreas is doing frequent blood sugar monitoring. So what happens in the body, in this behind the scenes, and I want you all to be really grateful for your pancreas, is that it is measuring the level of blood sugar that you're having. So if you eat a donut and your blood sugar spikes, your pancreas goes, oh, we need a lot more insulin to get that sugar out of the blood and into the cells. When you don't have a working pancreas that's able to produce the insulin, you have to, the type 1 diabetic has to do that themselves. So that involves, in the past, again, frequently pricking their finger to check their blood sugar level, and then giving themselves additional insulin on top of the probably long-acting insulin they have going on in the background. Again, I'm not sure when the first one was, but over the last maybe decade, there are more and less expensive ways of doing what's called continuous glucose monitoring. And this is really, really cool for type 1 diabetics, because they can just put on, often on their arm, they put on a little device that is continually monitoring their blood sugar, like every 5 minutes, and they have a little readout and can tell what it is. So this is quite lovely for type 1 diabetics. In addition to the insulin shots and the blood glucose monitoring that they need to do, paying attention to their diet is really necessary, and physical activity for staying healthy. So that's basically the current medical management for type 1 diabetes. And I want to be very clear that there is no treatment that is known in conventional medicine for curing diabetes. I do want to mention, however, when we ask the question, can type 1 diabetes be reversed? There are some occasionally, very rarely, there have been case reports of type 1 diabetes being reversed by really focusing on that autoimmune condition that's going on, so that we know, and this is more in the functional medicine and conventional medicine space, of using dietary and lifestyle changes to reverse the autoimmunity. In some cases that has been done. In type 1 diabetes, being able to accomplish that, in my experience, is very rare. I did find one actually published case report there of a reversal using a plant-based diet, but it's not very common. There is some ongoing current research, and I want to thank my friend Helen Perks over in the United Kingdom for alerting me to this. So there's some current research in the UK and probably other places looking at various immunotherapies, trying to address that underlying autoimmunity. I don't think they have anything up and running yet. And in addition, there is research being done into something called the fasting mimicking diet, which, at least in mice that have been made to have type 1 diabetes by destroying their beta cells, that it has worked to reverse the diabetes. So far, there is no human model of this that I know of, but these are things that are on the horizon and are being actively worked on. Okay, so that's what's going on as far as I know out there in healthcare. So let's move on now to the Institute for the Study of Peak States and our history as an institute in type 1 diabetes. So I'm going to take you back in time. I was not actively in the Institute at this time. I took a brief hiatus there from very beginning back in, or the early years, not the very beginning, but the early years back in the 2000s. And when I rejoined as medical director about 4 years ago. But back in 2011 was when the research team at the Institute first started looking at type 1 diabetes. And like so many things that we research, this was done because at the time, one of the students had type 1 diabetes, and he since became a therapist. He had type 1 diabetes since he was 12 years old, and the research team started looking at, could they reverse this? Now, back in those, at first, this was really pre-psychoimmunology and a lot of the things that we've been learning recently, but where they really started was doing organ level research. So they were looking, they knew that there was damage to the islet cells in the pancreas, and they thought, oh, well, maybe those just need to be repaired. So they figured out how to do that the best they could, or thought that's what they were doing it. And as they worked with this research client, try to repair everything. And as far as they could tell, it seems like his healthiest seemed healthy to them, but it still didn't work. His pancreas and islet cells were not working. And even though they had fixed everything they could think of to do, Grant says it was a complete failure and there was absolutely no change to his diabetes. When in the research we do in the Institute, this is what we need to do. It's like what any researcher does is you have a hypothesis. The hypothesis was using the techniques we have, using trauma therapy and such, we'll try to heal the pancreas. We think we did that. And then we get really real and say, does anything change? And nothing changed. The next thing that they looked at or realized, and now we're up to 2016 in this timeline, and thank you very much, Grant, for filling me in, because Grant was active back leading the team at that time. What they realized that, like other diseases that we knew about, cancer and multiple sclerosis are two that we know about, type 1 diabetes is what we call psychologically reversed. Now, that term used by Gary Craig from the developer of EFT means basically at a simple level that tapping on the problem won't help. That and the reason is that tapping and other trauma therapies don't help is at a very fundamental level, the client or patient actually wants to keep the disease. And they want to keep it at it's like a life or death issue. It's like, if I don't have this disease, I will die. That is basically the way the body consciousness is thinking about it. So it's desperate to hang on to the disease. Now, hopefully it's obvious to you that there's been a miscommunication somewhere, and the body brain, which is not in a peak state of consciousness, as Gilly was talking about in the earlier talk, and is in communication with the other parts of the consciousness, the other brains, doesn't realize that this is not logical thinking and is not a great strategy. It's kind of trying to survive on its own, and it has got this directive from somewhere that we must have, in this case, type 1 diabetes, or we will die. So in 2016, the team realized that this was going on big time in diabetes. And in fact, as they worked on things, they found that the patient's, the research client's body was actively trying to reverse and screw things up again. One of the things that happened, this is, like I said, weirdness abounds. One of the things that started to happen with the research team as they were working with this research client is during a session of research, the team members would go into la la land. They would kind of zone and space out. And in fact, later, they could not remember that they had done anything or what they had done. And what they finally found, and probably would have not found it, except for the fact that Grant was not affected in the same way with these memory loss parasites. He would just get irritable, but they were finally able to realize that there were some parasites activated in the research staff. And the thinking was that the research client's body was actively kind of tapping into this parasite and because trying to shut the research down. Welcome to research in the Institute. It does get a little bit weird at times. So they actually got past that problem, started video recording the sessions, but it continued to be a problem and they weren't actually able to fully get rid of these amnesia-like parasites. In 2017, we are now up to 2017, they started to work at the primary cell level instead of looking at the organ level. And this was exciting because they discovered within the primary cell that there was a pancreas organelle that seems to correlate with the pancreas organ. Now there is a pancreas organelle from the egg side and the sperm side, so there's actually two of them. But they were able then to tap in and look at this organelle. And in their research subject, it did not look good. It looked kind of deadish, sick. And in addition, what they found is that this organelle, as it secreted what it was supposed to be secreting, in the client it wasn't, but when they looked in themselves, that it was secreting something and made the cytoplasm feel alive. And in this type 1 diabetes research client, his cytoplasm felt gray and lifeless. So that was another research finding that they had. The psychological reversal continued to be a problem. And in fact, in 2018, when they were just about to make some breakthroughs as they were doing this, their research client abandoned the project. He didn't want to work on it anymore, had gotten tired, whatever rational thought he had going on about this, but he just couldn't continue. But in retrospect, or at the time, this is really the outplaying of that tremendous psychological reversal. Okay. What I want to show you now is basically our current understanding of what's going on in the primary cell around diabetes, or in type 1 diabetes. So there are a number of parasites involved. Let me see if I can show this here. So in the type 1 diabetic, first of all, as I said, the cytoplasm looks gray and lifeless. But what they had found along the way is that there is actually a fungus here, this thing that, I know this kind of looks like a fried egg, but it's not. This is actually a fungus. And this fungus was doing something really, really interesting. It was actually injecting or inserting material into these little round things here are ribosomes on the endoplasmic reticulum. So for those of you who haven't studied the book, Subcellular Psychobiology, it is available and you can read all about some of these things that I'm talking about. But when we are looking in the primary cell, there are ribosomes, which are on the surface of the endoplasmic reticulum, is what's called rough endoplasmic reticulum in microscopy. But this fungus was inserting something into the ribosomes that would make the body consciousness, here's the little pancreas organelle up here. I don't know if you can see my arrow, but here's the little pancreas organelle up here, and all this squiggly stuff is the yucky stuff that's making it not work. And these ribosomes here would send a message to the body to screw this up and keep the pancreas organelle screwed up. That's basically how the autoimmunity seemed to be working. So, aha, says the research team, let us clear this fungus. And we have techniques in the Institute to clear these fungal parasites. And when they tried to do that, lo and behold, it didn't work. And what's more, as they cleared these ribosomes with a technique we call of doing body associations, that didn't work either, because they would be reformed. The whole thing would just keep going in a cycle. And the body, clever body, this is how powerful we are, it would find more ways to screw the whole thing up over and over and over again. And no matter what the research team did to try to heal this and that, the body would find a way to reverse it. So this is the problem that Grant talked about in his talk yesterday, that we are actively holding on to diseases. And in at least type 1 diabetes with the autoimmunity, it's very powerful. The body's very desperate to hang on to it, and it kept shutting down all the healing going on. As they were trying to heal this fungus, they discovered another problem, that it didn't seem to actually be the fungus that was the primary driver of this, but this gold right here is another parasite they found that actually seemed to be driving the cycle. And what we think is happening is that gold parasite is trying to make a nice home for itself in the primary cell. And for whatever reason, it does not like a healthy cytoplasm apparently, and is working in conjunction synergistically with this fungus to do this whole autoimmunity process and keep the pancreas organelle screwed up. So that, in a nutshell, is what we know about what's going on in type 1 diabetes at a primary cell level. So I told you back in 2018 that the project had to be abandoned. They no longer had a research client to work on. But in February of 2021, I am happy to tell you, I'm very excited that the research has resumed. In fact, our very own beloved CEO, Shane McKenzie, who's part of our research, he is leading a team to revitalize or reinvigorate the type 1 diabetes research. So we have a new team which received a debrief from Grant and Kirsten about all of this I've just explained that went on before. And I want to give extreme gratitude and thanks to the previous research team who had worked on this. Some of the people Shane had talked about before, Nemi and Lila and Inka and Samsara and Agata, I'm sure had all worked on the diabetes problem in the past. the thing that made it possible for us to resume the research is that we have a new volunteer research client with, wait for it, he's got type 1 diabetes. And so he is actively participating. We started back up in February, and we're very excited, at least I'm very excited about that. And what many of the things we've learned in the last year as the research team has looked at COVID, when we've looked at that, we have learned so much about psychoimmunology, and that's really going to help, I think, as we move the research forward. So this is, for those of you who don't know what that little picture is there, it's a statue. It's called Standing on the Shoulders of Giants. And that's what I feel like, is that our current research team is standing on the shoulders of the giants of the research team and everything that they figured out before, because it's just given us this huge leap and step forward in continuing the research. I know I have all kinds of metaphors here, right? Little pictures. So I'm thinking of this as heading out from Basecamp. So what we've done so far when we started working back in February is we've basically corroborated the subcellular biology that I just outlined for you that was discovered by the previous research team. Now, so far, crossing all my fingers and toes, we have not encountered any problems with those memory parasites. And we didn't know, because the previous research team had just had the one client, if that was just something particular to him, or if that's something that is more universal in type 1 diabetes clients. I guess we'll find out, but so far that has not been a problem in this client. The other very exciting thing, if you remember, I mentioned the continuous glucose monitoring. So our current client does have a continuous, a Dexcom continuous glucose monitoring device, which from a safety perspective, for me as a doctor, I'm very excited about, because if, for example, we suddenly fix something and his pancreas starts pumping out insulin and he's already has other insulin on board, it could drop his blood sugar. So perhaps not super likely, but I don't want that to happen. So I'm glad he has that continuous glucose monitor. And then hopefully he'll be able to share the data with us so we can actually see more in real time what is going on with his glucose levels as we figure out and hopefully are able to fix things and try different treatments to stop that whole parasite dynamic going on there. Oh my goodness, time is flying. Hope for the future. So the implications of what I have shared with you are twofold. One are certainly implications for the clients. So if we can crack this problem, what we would come up with is actually what I would call a cure for type 1 diabetes. Remember, our body is super powerful. So if we can figure out how to extract it from this craziness with those two parasites going on so that the autoimmunity is stopped, we think that the body will be able to actually repair the pancreas and start functioning again. That's at least the hope, the hypothetical hope that we can do that. If we're able to achieve that, and as you see, this is, for me, this is our moon landing. This is our shot for the moon. It would have tremendous implications for clients. Certainly the health benefits of getting rid of the type 1 diabetes and the cost savings in treating it would be huge. But as far as implications for the Institute, type 1 diabetes for me is, I kind of think about it as like the holy grail disease. That's how I think about it as the medical director for applied research. Because unlike something like depression, which as impactful as that is, if we have a client, or many clients that we do have anxiety or depression, something like that, and we reverse it, it totally transforms their life. I totally get that. But from trying to start to get our work out there and get more collaborators in conventional medicine, as you can tell from what I just shared, they're like, oh my gosh, Mary, why aren't you locked up? You are just, this is like crazy talk, girl. What are you saying? But for type 1 diabetes, if we can figure out how to crack this and heal type 1 diabetics, that's something that we can test in the laboratory, because we can look that now they are not producing insulin and now they are. That would be really hard to say, oh, it was just all in their heads, or sometimes people recover from depression and anxiety, et cetera, et cetera. And in addition, not only that, in addition, what it would also do is possibly give us clues to other autoimmune conditions. So in medicine, there are 80 plus autoimmune conditions, and it's all of these are the body attacking itself, but the different autoimmune conditions, it's just attacking different tissues. So in Hashimoto's thyroiditis is an autoimmune thyroid disease where the body is attacking the thyroid. Rheumatoid arthritis, the body is attacking its own joints. So as you can see, the potential is absolutely huge if there are similar things going on with other autoimmune conditions. I just want to call out our current research team, led, as I said, by Shane McKenzie, my colleague Lars Vesby from Norway, myself, and of course, Grant and Kirsten, the co-directors of research, are there always helping us out with their brilliance. I thank you very much. I think I'm actually on time. Sorry, I don't have time for questions. Get a hold of me at drmary@peakstates.com. My Skype handle is mary.pellicer. And back to you, Shane. Oh my gosh, I did the time thing right.
Yep. So probably a very quick one here. Question from Carol. Are you currently looking for more research clients for this project?
Now that's a good question. I hadn't thought that we might have them. Yes, I think if you have someone that you think might be involved, it would be interesting to kind of have them in the wings. We really only want to work on one person at a time as we're trying to figure out what works, but having someone else that we could work with in the future would be very helpful in getting into conversation with that person up front. Yes, so send them my way.
Great. Thank you very much, Mary. There is another question there about healing at an organ level. I'll let you answer that one with a written response.
Okay.
Thank you for watching. For more information, visit peakstates.com/diabetes.php.